Be with you at 26 minutes to 9. Well, every year junior doctors are asked to take part in a survey. It's organised by the Australian Medical Association here in WA, and it's a bit of a hospital health check, if you like, where they come clean on their workplace. Are they being bullied? Are they being harassed? Can they cope with increasing workloads? Are they understaffed? And what about specialist training places? Are there enough? Well, 1,500 junior doctors shared their thoughts in the survey this year, and there are some worrying trends. Dr. Natalie Ferrington has been working in a public hospital for 2 years. She spoke to me a little earlier this morning. Have a listen to what she has to say, and then I want to know from you what you see and what you observe in our hospitals here in WA.
Good morning.
Let's look at some of the things in this survey. What does it say about staffing levels?
So staffing levels, according to the survey, are not doing very well this year compared to last year at all. In the areas of terms rosters and workload, we actually see it getting worse this year compared to last year, which is actually not surprising to us, but might be surprising to the public and a lot of other healthcare workers that might be feeling like their workload is slowly improving over the years. That's just not happening for our junior doctors.
Where are the pressure points in the hospital system? We're talking about EDs.
I mean, ED is kind of a very clear representation of many of the other departments that are maybe a bit less visible to the public. But really the pressure points are in those areas where there might be only one junior doctor to cover many patients over the weekend. I know weekends are a big point, and especially overnights as well. So our junior doctors in this state tend to work far more night shifts than their senior colleagues. Obviously, our senior colleagues have done what they can to support us in getting access to fair working hours, but the pressure points really are when junior doctors are made to cover overnight shifts and on weekends when there's not really that access to senior support, and they're left to often come to work the next day as well. That's a massive issue for us.
What's the concern with that?
So one of our biggest bugbears with the AMAWA Junior Doctors Society is that we really struggle to get access to the following day off when we are on call overnight. So very frequently, and this survey tells us that junior doctors are doing one on-call overnight shift every single week. So that means that often a junior doctor will get around 2 to 3 hours of sleep overnight. You're often receiving phone calls all the way through the night, and you get paid about $12 an hour to do so. And then you come into work the next day and you have to kind of continue on your week as if nothing else has happened.
$12 an hour?
So we get paid, obviously, our hourly wage when we're at the hospital, but if we're on call overnight and we have to receive phone calls and provide advice regarding patient care, then we're actually only paid around $12 an hour, yep.
So does that mean workloads have increased, and does that then lead to burnout being an issue?
Yeah, so absolutely. Our burnout is improving in a lot of the sites this year, and that was really helpful to see. I think the hospitals are doing what they can to improve working conditions, but there's only so much they can do when we just don't have the amount of staffing and training positions available to actually address those problems properly. So burnout, I think, is around moderate to high burnout affects at least half of our junior doctors across the state this year.
So does that then become an issue when you look at retention of doctors?
Yeah, it's a major problem. I think for our junior doctors, one of the biggest issues affecting retention is access to training. And so the ability to actually progress your career is just not something that our government is completely across and able to really reinforce. So that means that you get to a certain point in your career when you're at my stage before you have to look at other states, look internationally for places to go.
On ABC Radio Perth and WA, you're listening to Dr. Natalie Ferrington, a junior doctor, talking you through the latest hospital health check, which was a survey of almost 1,500 junior doctors. Let's look at training places then, because that seems to feature quite heavily in this report. First of all, are there enough training places for doctors?
Absolutely, unequivocally no. There is no way that every single junior doctor in this state, and I know it's an issue nationally as well to different degrees in different states, but it happens to be that you finish medical school and you think that you're going to be able to pursue the specialty of your dreams, whether that be surgery, whether that be cardiology, general practice, psychiatry, and you get to about 4 or 5 years down the track and you're one of 100 people maybe applying for 5 training spots in a state-based training program, which ultimately means that you can't specialise, and then you have to go interstate or internationally. It's very, very difficult and very taxing for our junior doctors.
And that comes at a time when you've got state and federal governments acknowledging that we need more doctors and we need more specialist doctors as well as GPs. So having those limited training places and then hearing that rhetoric from the government, it doesn't make sense.
Yeah, absolutely. I think there's a real disconnect, and it is a bit of a slap in the face sometimes when we hear our government opening up medical schools and, you know, to the public, I suppose sometimes increasing the number of doctors seems like it will fix the problem, but that's actually not going to fix our problem. If we get more doctors in, we're just going to lose doctors to go to other states to actually be able to specialise, because right now we're just not able to specialise at the rate that we need to be.
So this is about having more specialist training places rather than just allowing more people to go and study medicine.
Yeah, absolutely. That's where the bottleneck occurs. And I think if we were to enable more junior doctors to actually specialise and get into those colleges where they can pursue their training, then we would massively retain doctors in this state. And we do have unique set of problems in WA compared to other states, and we really need to be focusing on that.
What are those problems?
I mean, we obviously have a much greater proportion of Indigenous Australians and people who live rurally and remotely. In addition to people like FIFO workers, you know, I'm from Victoria and I didn't even know what FIFO meant when I moved over here, but they do carry, you know, the same kinds of health issues as many of our rural and remote Australians would. They suffer from burnout in a unique way. They have fatigue. We have remote Australians that cannot access a primary healthcare practitioner or an ED, and they always tend to have worse health outcomes because they can't access urgent medical care adequately.
And then we look on a related note, and this survey does look at morale and culture, and there did seem to be an improvement there amongst junior doctors.
Yeah, we were really happy to see some key improvements in the survey, and one of those areas was morale and culture. And look, I really think that that's about our hospitals actually really stepping up and listening to what junior doctors want. There are obviously going to be areas for improvement, but the morale and culture improving is kind of a symptom that, you know, our hospitals are trying to improve things for us, but when the workload is getting worse, we kind of just think, okay, well, hospitals are trying, but it is the system that's failing.
And then we look at the results, and it shows 30% of participants reported experiencing bullying, discrimination or sexual harassment. Is that still unacceptably high levels?
Well, I mean, obviously a rate of about 0 would be great levels of bullying, harassment and discrimination, but unfortunately it is something that happens in our profession at just completely unacceptable levels. And something that really does feed into this, again, is because of lack of access to training programs. And, you know, junior doctors are just simply not able to access the help that they need without massive career implications. And when our junior doctors face harassment, when they face discrimination, sometimes it is by patients who are frustrated waiting to see a doctor, sometimes it's by other medical staff, but a lot of the time it is also by senior medical practitioners. And that's just not something doctors don't strike, is because of the very, very real risk to their career.
Dr. Ferrington, have you ever experienced this kind of behaviour?
Absolutely. I've definitely experienced some really awful behaviours from some colleagues, from, like I said before, some very frustrated patients. I think most doctors have experienced it to some degree. I think obviously women are going to be at a higher risk of these kinds of things in the workplace, unfortunately.
Do you love your job?
I love my job. I try very, very hard to mitigate all of these things that are, you know, the little niggles that our junior doctor cohort really, really find difficult to manage, but that does not stop me from loving my job and falling in love with my job every single day. It's just a really, really hard situation.
On ABC Radio